So let's talk about mouth diseases. So as I mentioned to you, enamel, the most outer part of the tooth, and dentin can get affected by bacteria that grow in our mouth, right? So dental caries are the same as cavity, okay? So keep that in mind. A dental plaque is a biofilm around the teeth, on the surface of the teeth. You have around 700 species of bacteria in the oral cavity. Among them, you have Streptococcus mutans. And this bacterium here is the most important in forming caries. It's the most important cariogenic organism. What does Streptococcus mutans do? It converts sucrose into lactic acid. And then the acidity promoted by this lactic acid is what's going to lead to demineralization of the tooth. Okay? And what is the demineralization? You lose the minerals that constitute that dentin, right? Of the enamel and then the dentin of the tooth. And you start to have these cavities, these holes, right? If you look at the flow of how these plaques are, one thing that is important. Plaque is not always dental biofilm, that is what forms the plaque, is not always bad, okay? Dental plaque, if it's removed, is usually not bad, okay? So, I was going to show you that there is like these steps into the flow of bacteria on the surface of the tooth, okay? So if you look at this figure, you're gonna see that you have first bacteria that are commensals, okay, that they are part of your microbiome, and then they accumulate and make that biofilm. That biofilm, if you don't brush your teeth and you keep this biofilm growing, you start to have deposit of the pathogens. See, these are the pathogens. And that's how they start to accumulate, and they are the ones that are going to promote the acidity. So you're like, okay, convert sucrose, but sucrose comes from the diet, right? So I'm going to tell you about sucrose from the diet in 1 minute. I just want to mention that also you can have other bacteria other than strep mutans, like lactobacillus, actinomyces, bifidobacterium, and low pH tolerant streptococcus species that can lead to cavity, okay? So if the demineralization process is more often and for longer time than remineralization, then you have cavity. But usually you have a little bit of demineralization and your teeth are able to rebuild those minerals and rebuild the tooth, and then you don't have caries, okay? So this is constantly happening. Your teeth are constantly trying to fight the formation of that cavity, but then if demineralization is too much, then you're gonna have caries or cavities. I said sugar, right? And I said sucrose. So sucrose is the table sugar, right? When I say table sugar here, I do mean sucrose. Sucrose is the most important sugar that leads to that fermentation and formation of lactic acid by the strep mutans. So if you don't eat sucrose, you have a much lower tendency of having cavities. There is a study that shows that before we introduced table sugar to our diet, so in the past, people had only 10% of what we see of cavity nowadays. So it was a lot less, okay? And you say, well, but I eat sugar, but then right away I brush my teeth. The strep that is in your mouth, ready to get that sucrose, doesn't wait for you to go straight to brush your teeth. Once you eat the sucrose, you're already gonna have the strep doing fermentation of the sucrose right away. So, of course, brushing the teeth will help, but it doesn't avoid. So the more sugar we eat, the more sucrose we eat, the more we can have a tendency. Of course, it's going to depend on your mouth microbiome and some things related to genetics, but that's going to lead to more cavity. Okay? So stages of tooth decay. So first they form a plaque, and that plaque starts to increase as it starts to absorb and waste the enamel. And then when that is advanced, it starts to affect the dentin. And then decay in the dentin will lead to decay in pulp. And that leads to like you're losing your tooth, you need to remove it. These diseases here are called periodontal diseases, gingivitis and periodontitis. These diseases are not in the teeth, they're in the gum, right? Periodontal, around the tooth. So gingivitis is the inflammation and infection of the gums, usually caused by streptococci, actinomycetes, and some anaerobic gram-negative bacteria. Gingivitis, this inflammation can get worsened, and when it starts to be taken over by porphyromonas is when you have periodontitis. And periodontitis is what? What's the difference here? You're not just have inflammation in the gum. You have bone and tissue supporting the teeth being destroyed. Okay? So if you look at the stages of periodontal disease, you're going to notice that this would be a health gingiva, and as gingivitis starts to have that inflammation in the area, and with periodontal disease, when the porphyromonas start to grow in the sides of the tooth, look what happens to the bone. Where is that part of the bone here? It got consumed. You start to have bone loss. Okay? This is genetic. This is hereditary. It's not, if you say, oh, I had this and I always brush my teeth. You can do the best job ever brushing your teeth and you may still have it. And look what happened. Look at the pocket that it forms. So when you see gum recession is due to periodontitis. Look what happened to the gum of this patient in advanced periodontitis here. See, the gum was here, and then with the gingivitis first, one thing is important. Look at the color. Look at the color of this gum compared to the color of this gum. See how this is much more red? Inflammation. Opening, dilation of your blood vessels. That makes more blood influx. They get more red, right? And then you start to have the recession because the little bone that was here between the teeth is being consumed, right, by the bacteria. And then it gets to a point that is advanced. So in these cases, what patients need to do? There are treatments for cleaning this bacteria. There are laser treatments to clean this bacteria from the side of the tooth. So you stop at that stage. There are bone engraftments that can help to rebuild the bone to a certain level, not completely, but to a certain level. There are gum engraftments that can do, like you take a piece of the gum, for example, from the mouth roof, and then you attach here so you have a little more gum in that area. And flossing. Also, seeing the dentist like every 3 months if you have periodontal disease is essential to avoiding the disease to progress. Okay, guys. In the next video, we're going to talk about digestive system infections and intoxications. Talk to you soon.